Hello everyone. Happy Monday. Hope you had a great weekend. My name is Rendy Murphy. I'm an epidemiologist and the Director of Disease Surveillance at the Mobile County Health Department here on Monday, October 5th to give you our brief update on the impact of the COVID-19 epidemic on Mobile County. Globally, over 35 million cases and over 1 million deaths from COVID-19. In the United States, we're approaching 7.5 million cases of COVID-19 and 210,000 deaths. And again, the U.S. has the highest number of hospitalizations and deaths than any other country in the world, followed by India and Brazil. In Alabama today, the Alabama Department of Public Health is reporting on 159,713 cases of COVID-19 and 2,559 deaths. So for Mobile County, the total number of cases of COVID-19 stand at 13,784 cases. 6 cases were added yesterday, a shockingly low number. We're looking into that to make sure that that's not influenced by anything artificial. But I will mention that over the weekend, so Friday there were 49 cases reported, Saturday 52, and then 6 cases reported yesterday. 299 Mobile residents have died with COVID-19. We added 1 since our last report, and the cumulative number of people hospitalized with a COVID-19 diagnosis is 2,068. That was an increase of 3, and currently hospitalized, we're showing yesterday there were 78 people in Mobile hospitals who had COVID-19. That was a slight reduction from the day before. So just to give you a little bit more sort of on what our week looked like last week. So in our weekly expanded report, it hasn't come out yet because we're still doing a few little tweaks on it. So again, with around just under 14,000 cases, that puts the number of cases per 100 population, or our estimated rate, at 3,254. Now, if you look at the rate broken down by age group and by sex and by race, we still see the highest per capita cases of COVID-19 reported in the 18 to 24 age category, really driving that community transmission. The rate is highest among females and among African Americans. And we see the highest rates of disease in our zip codes of 36605 and 36608. Really excited for the expanded report to come out today because we have our new GIS analyst, Justice, has been working on a couple of maps for us to add to the report that will be a little bit more meaningful for you, we hope. So last week, 335 cases of COVID-19 were reported to the Alabama Department of Public Health and available to us for investigation. So again, that was the weekend, Saturday ending October 3rd, 335 cases, and that was down slightly from the previous week of 402. Remember, I mentioned Friday that our risk indicator, which is calculated using a totally different, it's not based on report date, it's based on the date, the closest date to the person's infectiousness, but we've moved back to the orange category of very high risk. And again, most of our benchmarks we're making, but since we're seeing an increase in a little bit in the number of cases reported, then we are going back into the high risk category. Let's see, just to mention that when we look at the number of cases reported each day, if we look at the moving average to try to smooth out some of that noise, we're seeing 55 or so cases added per day, but a much better look to our data than we had just a couple of months ago. Still, our peak for the summer was in July with 4,735 cases. In August, we reported 3,798, and for all of September, only 1,374 cases. We know that is impacted somewhat by the availability of rapid tests And we also know that it is an underreporting of the true number of cases in Mobile County. A recent paper estimated that nationally, excuse me, nationally, there could be as many as 8.6 times as many cases of COVID-19 for every confirmed cases that is reported to public health. And in Alabama, that estimation could be as many as 10 times, meaning that it could be that for every one case we know about in Mobile County, that there may be another 10 cases out there. We're super happy about rapid tests, super happy that, clinicians are going to have a way to very quickly tell someone if they have COVID-19 so that they can get home and isolate as necessary. It just interferes a little bit with our ability to conduct traditional public health surveillance. So our hospitalizations have ticked up just a little bit. We had gotten down into the 60s, and then for the past 10 days or so have averaged in the 70s number of patients hospitalized on any given day. So we will keep a close eye on that as well. Deaths continue to drop. Super excited about that. We think a lot of that has to do with our nursing homes better able to manage COVID now that they know about asymptomatic infection, and they have plenty of test capacity out there, and there's a lot of testing going on in the nursing homes now. And so that's protecting those very vulnerable populations. So we hope, and we have other, therapies like remdesivir and some convalescent plasma that's being used to treat COVID patients. So we think these things are really helping to reduce our death rate. Let me go back and mention what that is. So on the weekly report, it's showing 2.2% of cases have died. That's a death rate of just 72 per 100,000 from COVID-19. So really good to see that. Another indicator we look at on Mondays is the percent of laboratory tests that are positive. And again, these are the laboratory results that are reported to public health through our traditional surveillance systems. And last week, that percent positive was down around 5%. I think nationally it's right around 5%. So we're tracking with what CDC is reporting nationally. So we still have plenty of tests that are being conducted, but a much lower positivity rate than we had back in July or back in the first part of our outbreak. All right, let me see if I can flip over here to see if I can get to the new maps. So we have two new maps this week. One shows the cumulative rate of reported COVID-19 by zip code. So you will see this is adjusted again for the population. So think about this as sort of a per capita. It's going to look a little bit different than it looks when we're just talking about the number of cases, because the highest number of cases are really driven by the zip codes that have the highest population. But when we account for the population of each zip code, then we get the cumulative rate adjusted for the number of people who live in any zip code. So it's going to look a little bit different. And then another map that we're happy to share is the density map. So basically for the past 2 weeks, Justice plots the address of the COVID positive Mobile resident. And then you will see some darker reds and yellows where the number of cases close by is the most dense. So please take a look at those and get some idea about where we have the highest density, the highest number of cases reported by residential address. And I seem to have a tickle in my throat today. So let me try to get to a couple of questions, and if this persists, we'll have to push them until Friday. All right. One question was about the risk of COVID depending on the blood type that you have, and there have been reports in the media, in the international media, in the national media, and the reports have sort of gone back and forth. Some saying there is an association between blood type and severe disease, and several saying there is no strong association or no association or strong association. Thank you. Thank you, James. That there isn't really no association. So the science is still out. There's still not enough science to really say one way or the other. But let me read you a statement that was published by the Journal of American Medical Association, and it is that the basic science on this is extremely weak. Again, we're talking about any relationship between the severity of illness and COVID-19, depending on your blood type. So the basic science is extremely weak. So at least for now, blood type should not be used to identify which people who become sick with COVID are likely to develop severe disease. So stay tuned on that. All right. The next question, we had a couple of people who wrote into Facebook saying, what is with the businesses around here? Why aren't they, requiring customers to wear a mask? Why aren't they making sure that their employees are following the mask mandate? And again, to remind you is that the Mobile County Health Department is not our role to police or enforce the mandate. I really think that that's probably an unrealistic expectation that we would be able to police or enforce a statewide mask mandate. However, if you send the name of the business, the address of the business, and the telephone number of the business to iscomplaints@mchd.org, we will call them and talk to them about the Safer at Home order, try to encourage them to adhere, explain to them why it's in their best interest to follow the mandate, to avoid COVID getting into their facilities and potentially shutting their business down because they don't have enough customers or employees because they're out with COVID. So if you will send an email to iscomplaints, again, we need to know the name of the business, the location, and hopefully the telephone number so that we don't have to dig that up. All right. And then someone else asking about face coverings protecting you from viruses like COVID and the flu. So yes, face coverings have been shown to reduce the respiratory droplets that carry COVID-19 from escaping from your breath in the air. So you wear that mask covering to protect the people around you in case you have COVID and don't know it, or you're not adhering to the isolation order and you have COVID and are spreading it in our community. So wear a face covering. And the same things that we say to reduce COVID, wear a face covering, keep 6 feet distance between you and anyone that's not in your household, cover your cough, stay at home if you're sick, wash your hands, wash high-touch surfaces. All of these things will also protect you from influenza and other respiratory viruses that circulate during flu season. So we do expect that it won't surprise us if we see less flu this year. It will be interesting to see how COVID and flu, impacts patient diagnoses, patient treatment, patient movement. So again, get a flu shot now. It's not too early. Try to get a flu shot. We are going to have some adult vaccine free in the next couple of months, and we will try to have some outreach to make sure that any adult who wants to get a flu shot can get a flu shot. You can contact the health department at 690-8889 for COVID testing or for vaccination for yourself or your children. But stay tuned about what this season is going to look like with seasonal influenza and other common respiratory viruses circulating at the same time as COVID-19. Wear your mask. It will reduce transmission in our community. It has proven effective in doing that since the mask order mandate went into effect on the 17th of July. I think we've seen a dramatic drop in the number of COVID cases. So I'll end for now. I hope you have a great week and stay safe.